Hospital data from the Australian state of New South Wales offers tentative evidence that the Covid-19 Omicron variant is milder than previous coronavirus strains. According to an analysis by Andrew Lilley, an economist at Diem Association, early admission figures suggest Omicron could be half as likely to put people in hospital as a Delta variant. Mr. Lilley, a PhD candidate at Harvard University, estimated the hospitalization rate for COVID-19 had fallen from 6.9% to 3.6% in recent weeks as Omicron became the dominant strain in the state. Using official statistics on patients on admission, Andrew Lilley created a hazard rate and said he was quite confident the strain is inherently milder, although it would take more time to know the true hospitalization rate for the mutation of the variant. Mr. Lilley's analysis has not been peer-reviewed. There are also some other studies which say the variant is milder. And Dr. Abiye Hector Goma is a clinical director at the Chapeltown Primary Care Network, and he joins me from the United Kingdom to discuss this. Welcome to World Now. With a recent finding, does that mean we've made too much of a fuss about COVID-19?
Thanks for having me on the news again. And the answer is, I don't think so. Let me take what we are seeing in the United Kingdom. For the first time on Tuesday, we got above 100,000 cases per day of COVID-19 since the pandemic started. For the first time, over 100,000. So the spread of the Omicron variant is so much more than we've seen since COVID-19 started. So yes, the early findings are suggestive that it is there's a kind of a reversal of the cases versus death ratio. Yes, looks like there is a reduction in hospitalization, but the number of cases that we are seeing is far overwhelming. And we don't really know yet, even though it looks milder, but people have what is called long COVID. After the initial infection, they have symptoms going on for weeks, months, and many people have had COVID for such a long time. The symptoms are still going on. So yes, there are fewer case fatalities for now, but the spread is much rapid than even the Delta variant.
Well, the study found that people who were hospitalized with Omicron in October to November, were 70% less likely to develop severe disease than those admitted with Delta between April and November. So what variant should we dread? Does that make Omicron a lesser evil?
Well, first we need to understand why there is the severity is reduced. There are a few possibilities. One is that because of the Delta variant, a lot more people were infected. And because a lot more people were infected, they have some immunity, so the Omicron variant is less fatal, as it were. So even if they get into hospital, the disease is less severe. So one is that people may have had infections already. And then also in some parts of the world, a lot of people have already been vaccinated. They've had 1 or 2 doses, and that has also given them more immunity, as it were, to withstand whatever Omicron offers them. But the bigger picture is that where people have refused to be vaccinated, then it means that those who get infected may be the ones that bear the brunt of the disease. They are the ones that are more likely to get into hospitals. So that problem is still not gone away.
Well, since Omicron variant has scaled international borders, can this recent finding be generalized to other countries in sub-Saharan Africa, for instance, that also have very high levels of previous infections?
Excuse me. Well, the fact, like you've mentioned, is that if the Omicron variant is less, the disease is less severe, then it means that wherever it is in the world, people are going to have less severe diseases. But if it is less severe because people already have a higher level of immunity from previous infections, then when you look at the examples, it may not necessarily translate in those in those countries. So when you look at, for example, Africa as a whole has had less cases than the United Kingdom, which is a much smaller population, even though testing is far less in Africa. It might be that because there's less immunity, then the Omicron variant may have more case fatalities than we are seeing here.
Well, I would like to confirm these, to confirm your thoughts or your statement on this, because what I'm looking at is that results of a study by the Imperial College London released last week showed there was no sign that Omicron was milder than Delta, although data on hospitalizations remains very limited. So could this be as a result of the fact that world over vaccination program continues to grow, as so much so that infected persons may not require hospitalizations as against the time COVID was novel?
Well, like I said earlier on, everything depends on what is going on in a particular country. So where you have high levels of immunization in a country, then the impact of Omicron may be less. And where you have high levels of previous infections, maybe with the Delta variant, then also the effects of Omicron may be less. But where you have countries, for example, which have fewer, less immunization and less Delta variant spread in that country, then the impact of Omicron may be a bit different from what we see in those other countries where we have the research findings. So what I'm saying is that, fingers crossed, maybe Omicron is actually less transmissible, more transmissible, but less severe. But whether that can be said in every country where Omicron now finds itself is to be seen.
Makes sense. Let's see how people, because the call has really gone out to a lot of peoples of the world, that they should be careful, especially this festive season, to ensure that they don't spread COVID-19. Thank you so much for speaking with us. The Clinical Director, Chapeltown Primary Care Network, Dr. Abiy Hector Goma. Thank you.
Thank you very much.